So I get this question a lot because I deal with a lot of parasitic stuff. We deal with all the different things. And after Bang wrote the book, How the Chiropractor Saved My Life, about what I did with her cancer, people always want to talk to me about parasites and cancer and ivermectin. There is apparently a growing number of people who believe that cancers are just big balls of parasites because ivermectin kills parasites and ivermectin helps, and fenbendazole help with cancerous tumors. To my knowledge, there's no research showing that they are big balls of parasites. Can parasitic infections somehow be tied to cancer? I mean, sure. I mean, if you want to be like, okay, so we have a bad parasitic infection that's creating systemic chronic inflammation, radically reducing B vitamins, radically reducing mineral function. So you create a systemic inflammatory environment that has low oxygen, low B vitamins, low mineral content. That's kind of a recipe for cancer. So yeah, I mean, there's a pretty solid thought process link between parasitic infections and cancer. I'm not going to tell you if you get a parasitic infection, you're going to get cancer. It's not what I'm saying. The reason that we see ivermectin, fenbendazole having positive effects on cancer in some of the research and anecdotally with all these people talking about it is and from what I'm getting in the research and everything, it's not every cancer. It's a decent amount of them, but it's not every cancer, is because the way that nematodes and parasites and stuff like that, their metabolic process is similar in a lot of ways to the way cancer functions, because cancer has a different metabolic function than healthy tissue. And the ivermectin and the fenbendazole, the way that they work, breaks down the metabolic function of both the parasite and these specific types of cancers. So we have seen significant benefit in some research studies and in a lot of people that I've worked with and talked to with using ivermectin and fenbendazole for cancer. But it's not because the cancer is a big ball of parasites. It's because the metabolic function, or the way that the cancer feeds and eats and grows, is directly linked to the same pathways that some of the parasites are using. So the other side of that is, when we look at options for doing things, one of the things that we always look at is, what's the risk and what's the benefit? Okay. And the risk of taking ivermectin and the risk of taking fenbendazole, or fenbendazole is the veterinary form of menbendazole, which is basically the same drug. One's marketed to humans, one's marketed to animals. The risk is very low. I'm not going to say it's zero, but it's very low of taking these things. We haven't seen a whole lot of negative function, and I bet you we would have during COVID, because people were taking way too much, way too often. And we didn't really see any negative effects. So if you're looking at it and you're like, hey, there's a 10% chance it'll help kill the cancer and a 0.1% chance it'll be bad for you, it's worth the shot, because cancer will kill you. So, it's one of those things where, should you take ivermectin every day? Probably not. That's probably not a good idea. I wouldn't necessarily recommend that. If you have a reason, then yeah. But it's not one of those things that I would, like I said, take every day. We are seeing in both research and in people I'm talking to and people I've worked with and people I've seen, significant benefit from it. So my question for you would be, again, you go back to the original premise of safety, risk versus reward. If you look at it and you're like, hey, I have cancer, or my brother has cancer, and you look at it, how much negative function will you get from the ivermectin fenbendazole? You're like, it's almost nothing in this particular person. Well, then I would go ahead and try it. Now, having said that, if you guys are on 15 different medications for cancer and chemo and all that fun jazz, there are things that normally wouldn't cause a problem. So for instance, you could take a bunch of ivermectin and fenbendazole normally. However, because of the other drugs you are on, it would cause a reaction. So don't just take stuff willy-nilly. Get checked. Talk to the pharmacist, talk to whoever. and kind of figure out, hey, if I take this, does it react poorly with this other medication? My guess is that what your doctor is going to tell you is not to take it because they don't know, which is also not the worst thing to do, because if you don't know about reactions, it's better to err on the side of caution. So the answer they gave you of don't take it while you're taking all these other medications is the accurate, better answer to give. However, the reason they're giving you that to you is because they don't know. And if we're going to make a stance that, we're not going to take vaccines because they don't have safety tests done, and since we don't know if they're safe, and so that's why you're not going to take vaccines, then you kind of have to apply that philosophy across the board and be like, if we don't know, we're not going to do it. So I have patients who have chosen to not go the traditional medical route and go the ivermectin fenbendazole route, and they ended up taking no radiation, no pharmaceuticals, and they don't have cancer now. That is an anecdotal thing that I have personally seen. However, it is not a thing that I am necessarily recommending to you. So keep that in mind. And if you guys are wondering about how that works, look it up. The metabolic research is actually pretty open, if you understand metabolic function. But that's kind of where that is. So it's not that cancer is a big ball of parasites. We need to kind of understand that and kind of back up off that a little bit. But recognize, again, everything is metabolic. Everything is metabolic. So you're a big metabolic machine. So we can figure out how the metabolic function works. We can correct it. So that's how the ivermectin fenbendazole is working. Again, not saying that people should avoid the traditional medical route and go with this. I'm also not telling you that you shouldn't. So it is your call. You're a living adult. You can figure out how you want to do it. But that's the big thing on the parasite thing. I keep getting asked. And so that was one of the things I wanted to go through. You guys have a fantastic day.